From the Toronto Star, I'm Adrian Cheung, and this matters. On the COVID front, there's a lot to keep track of. And now there's new research on how face masks can be made even more effective. A study from the Centre for Disease Control finds two masks, a cloth mask on top of a surgical one, being better than one mask. The research found doubling up blocks out 95% of the inhaled and exhaled particles. On This Matters, we're talking to Dr. Colin Furness, epidemiologist at the Dalla Lana School of Public Health at the University of Toronto. Dr. Furness's work focuses on infectious disease control. He'll help us sort through the confusion around face masks. Should we be double masking? Do you need a mask even when you're outdoors? We'll also tackle everything else that's probably on your mind right now. The vaccination program, the risks of reopening, the COVID variants, and a possible third wave down the line. Dr. Furness, welcome to the podcast, and thanks for making the time to talk.
My pleasure, thanks.
I wanted to begin with the news here in Ontario around the COVID variants and the response to it. The Ontario government, they're lifting stay-at-home orders in 27 health regions. At the same time that health experts on their staff and health experts elsewhere are warning about the spread of the variants and a possible third wave. In your expert opinion, what do you make of that strategy?
It's a really complicated landscape. There's no question that COVID cases globally, never mind in Ontario, are currently dropping. And obviously, that feels good. The problem, though, is that it's masking something a little bit more concerning, which is whereas most COVID cases are going down, cases of variants of concern are actually going up. And we're just not noticing that yet. In other words, if we didn't have variants of concern, cases would be crashing really hard, really low, and that would be a lot to be happier about. If we didn't have variants of concern, I would be feeling really optimistic. The problem, of course, is that we do have them. It's nothing unexpected. It's pretty straightforward. If you give a virus enough of a sandbox, that is to say, millions upon millions of people in which to reproduce, it will mutate. It will find a way to establish itself more effectively among humans. It's only had about 10 months to learn how to inhabit humans. It's learning. It's evolving. That's what viruses do. That's what life forms do. It may well be getting more dangerous. There's some equivocal evidence there. That's not what it's trying to do. It's simply trying to reproduce more effectively. And that means being able to be more contagious, spreading more readily. And it's doing that. So my concern is that we are, yes, approaching a third wave. We've seen it happen in Europe already. It's not astrology. It's pretty clear just looking at the patterns saying this happened there. We've got exactly the same situation going on here. So that's concerning. And obviously opening up is not what you want to do if we're facing a third wave. On the other hand, we've had punishing, brutal lockdowns that have taken a huge toll, an economic toll, a mental health toll. We have an upswing in babies presenting at hospital with domestic violence injuries. So when you actually think about the toll of a lockdown, from a government standpoint, cases are down, you want to open up, you want to let out some pressure, you want people to be able to get back to work. That's pretty compelling too. And so you've got these two very compelling narratives that are in conflict with each other.
That these two things are not siloed of one another. Our mental health, the way we're actually living, and the spread of the virus, that goes hand in hand.
Well, they do. And this is why we're in I don't want to say it's a no-win situation because that sounds needlessly negative. The problem here is that we in Ontario and in many places have taken a reactive approach. Let's wait till case counts get bad. Let's wait till we're in a really bad situation. And then we've got nothing else to do but lock down. There's nothing else to do at that point. Everywhere that prevention has actually ruled, everywhere that avoiding cases in the first place has ruled, everywhere the governments have made those kinds of decisions, outcomes have been way better. Far fewer days in lockdown, far fewer problems. So unfortunately, we've taken a bad situation and created an even worse situation where if we lock down, we cause harm. If we don't lock down, we cause harm.
You mentioned the possibility of the third wave. I know a lot of people right now don't even want to think about that because the second lockdown already is hard enough. But on the track that we're at right now in regards to case numbers, weighing the variants and their effects, the vaccination programs. Is there still time to avoid a third wave in Ontario, you think?
I don't think we're going to avoid it. I'm hopeful that it's going to be brief. So I'm concerned that what we're going to see is a rapid rise in cases very rapidly. That's what we saw in Europe. That can overwhelm healthcare. If that happens, mortality goes up because most people survive COVID, but most people with severe illness need hospitalization, need medical intervention. And if we don't have the ability to do that, I think it's going to be tragic in ways that, honestly, I can't even really quite imagine. And I think very hard to imagine what that would look like. So that is the big risk. However, the weather will get warmer. Vaccination is ramping up. It's slow, but by April, when I think we may be in the worst of this, vaccination will pick up. So it is a little bit of a race between, weather and vaccination helping on one hand, and the spread of variants of concern on the other hand. And they do interact because variants of concern in some cases may avoid vaccination. That is to say, they may be able to evade, rather, the vaccine. So that's a concern, no question. So I think the vaccination is going to be a more complicated story as well. It's not going to be that we all get vaccinated this summer and we live happily ever after. I suspect that we're going to need a booster. I think we're going to need a few. We may be playing a bit of whack-a-mole with variants and vaccinations. And the vaccination landscape is going to be really crowded as well. So it's pretty muddled in terms of imagining what the end game looks like. I think we win. I think vaccines win. I think COVID does not get to dominate us, but we're not there yet.
The B117 variant, it currently accounts for around 5 to 10% of COVID cases in Ontario. Dr. Edelstein-Brown, he says he expects the variant to be one of, if not the dominant strain here soon. What do you think the public should know now? We understand that there are vaccines out there. It is ramping up, but on a person-to-person level, does it change the way we try to control the spread? Or do we not know enough yet?
We know enough, I think, from the UK and Ireland experience. We can't be positive that 117 will behave the same way here. Different genetics, different climate, there's a lot of differences, different cultural practices, different restrictions. So there's a lot that's actually not comparable between the two. But whereas it was about 5% of all cases, I think this week is more like 20% of all cases. And then another couple going to be 80% of all cases. So that's not a possibility. That's happening. What we know from the UK and Ireland experience is, yes, you can get it under control. This is not catastrophic, but you need serious restrictions in order to be able to do that. And that's really exhausting. That means closing schools. That's a hard thing to say, given that my kids are actually back in school since December. It means closing schools. It means really closing down a lot more. In other words, going back to this idea of a stay-at-home order. I don't like saying that. I don't relish saying that because I know all the harm that portends. However, we've created this situation. And I want to be clear, this third wave, in my estimation, is an airline wave. It's a travel wave. It's a vacation wave. It's the wave that we didn't have to have. It's the wave that we decided was okay to have because we didn't want to stop flying. And that's particularly frustrating to me because since last summer, I've been waving my arms saying we have to curtail travel. I mean, we really have to curtail travel. And it's when cases drop down, like they did in the summer, that people start to say, no, we can do whatever we want. And of course, cases are dropping now and people are coming back and saying, no, we want to be able to do whatever we want. So we're creating this situation. I think it needs to be really clear. I'm not sure we can do much about it now, but for the next pandemic, we really have to look at air travel and say, this is not okay. This is not safe. This is not what we should be doing.
So you think with the third wave, the spread, and especially the prevalence of the variant, you think it'll spread differently than the last 11 months, the last 12 months of this pandemic?
There's evidence that the variant is more effective with younger folks, so that you'll see more penetration there, that you'll see more clinical illness there. COVID in children still remains a bit of a mystery. On one hand, it seems to infect them less. On one hand, they seem to be less infective. On the other hand, they seem to be more asymptomatic, which means we're probably under-testing and under-diagnosing. So we don't have a really clear picture. But from the UK, Ireland experience, it looks like younger people and kids tend to manifest with significant illness more frequently. So that is going to be different. That's going to look different than how it was. Other than that, I think it is going to be more of the same. Fortunately, long-term care home residents now have almost all, I think, received at least one dose and will be circling back, I hope, to get second doses in. One dose seems to be pretty good protection, at least in the short to medium term. So I think we're not going to have the same incredibly tragic outbreaks and widespread death that we have seen in long-term care homes, which I think traumatized all of us. But older adults in the community. I mean, people who are older than 70 years old do have a lot to be concerned about here. And now I think for the first time, younger folks need to be worried too. And that's obviously not something that is easy to talk about, and not something that we should be looking forward to.
We'll be right back. We'll shift now to face masks because there is new research around that, and we'll get into it. But Dr. Furness, what do you think we've learned in the past year about mask use, especially during flu season? What part about that do you think will have maybe a more lasting effect on how we use them, even whenever this is all over, post-pandemic?
Masks represent one area where we have perhaps learned the most. And I hope we continue to learn and understand the relationship between mask use and respiratory disease. There are parts of the world, I think about Asia in particular, where culturally speaking, wearing a mask is not that unusual, is not that revolutionary. In Taiwan, for example, where they're very open to wearing masks and actually where a lot of the world's mask production takes place, they did very well with COVID. They didn't actually have to think about it and talk to the experts and disagree and spend time coming to that. Whereas in the West, that's what we did. All of us, all the experts said mask wearing initially doesn't make sense because the conventional wisdom, which is still valid, says the mask is actually not protective to you. And we kind of stopped there. And so I think we all had a really humbling moment to take a step back and say, wait a minute, we've simply been asking the wrong question. The question really ought to be is not does the mask protect you, but what is the role of the mask in interrupting or disrupting transmission? And when you ask that question, all of a sudden, any mask, it seems, if it covers your mouth and your nose, even if it doesn't fit well, even if it's not made out of ideal materials, seems to be having a very positive effect in disrupting transmission. The mental model I use is a tipping point. So imagine that when you go out onto the subway or to work or when your kids go to school, they almost get infected. Imagine they almost get infected every day. And that mask wearing by people around them disrupts those aerosols, disrupts what's airborne, basically reduces it to the point that it's actually no longer quite dangerous. That, I think, is a really good way to understand the role that masks make. And so the idea that we need to be really obsessed about, well, they need to fit, they need to seal, they need to be a certain number of layers, they need to be made out of certain materials. Well, those are all relevant. But so far, they haven't actually been nearly as important or significant as the act of actually having something interrupting that exhalation, that blunts the projection of droplets, that simply reduces or interferes with the production of aerosols. And I think that's been one of the pieces of really good news here is that it's a pretty simple intervention. It's a nuisance, but it's, if you had to choose between masks and lockdowns, I think you would say masks are pretty innocuous as far as interventions go. So we have learned a ton. Just a ton. Recently, I watched a 1918 newsreel that was, well, not a newsreel so much as it was an educational film on how to protect yourself from Spanish flu. And they're talking about mask use. And what's funny about that is they felt that masks protect you, that back then, actually, they didn't have a strong sense of what viruses really were. They thought they were liquids. And so their mental model was the mask will prevent the virus from entering your body. And masks do provide a little bit of protection that way. That's not the thing that should make you feel safe, though. You should feel safe when other people are wearing masks. Now, would better masks be better? Would that limit transmission? We actually don't know. Intuitively, yes. But again, if we think about it as tipping points where people are almost getting infected and masks are interrupting that, it's not clear that being really obsessed with mask design and materials is going to make a huge difference. We should be doing that research. We should be learning. The one thing we have now that we didn't 100 years ago is a lot of scientific capacity to test different materials, to test different designs, to come up with a better mask. We're not done with respiratory disease. Even if COVID goes away completely, which I doubt, we're still going to have influenza. We're still going to have other emerging diseases. We're going to have more pandemics. And so I think next time around, we will actually really have a great science of masks and really how they work and really what's ideal about them. So I guess that's a way of saying I don't think we need to be horribly concerned about mask design right now. But I think everything we learn about that in order to make better ones and really just better understand exactly what their role is, that's going to benefit all of us.
So if not exactly mask design, then there's also this issue of, well, how many masks should you be wearing? Because the Center for Disease Control in the US, they did a study that boils down to, well, 2 masks are better than 1, that it blocks out more particles. And that makes sense. And so I wanted to give people a cheat sheet on what they should know right now for this winter on mask use. Let's run through some questions. Should we be double masking?
It's not clear that we should. The CDC did a study, and I think it's important work to do. And it was a lab experiment, essentially, saying if 2 masks are in place instead of 1, does that block more virions? Does it block more particles? And, intuitively, the answer is yes. And sure enough, in the lab, it's yes. Okay, the problem here is that what you discover in the lab doesn't necessarily play out exactly the way you would want it to in real life. That is, what 2 layers? What is the agitation to the skin on the face? What is difficulty in breathing like? That's a problem. Some people feel very uncomfortable with 1 mask. And so say now it's culturally normal to wear 2. Well, masks right now, as we stand today, were not designed to be doubled up. So the impairing of breathing, physical discomfort, those are things to consider very carefully. So I'm not firmly against wearing 2 masks. I'm not certainly recommending it because I don't think we actually know enough. But I learned my lesson right from last spring. I'm not going to say absolutely no, don't do that.
There are no certainties anymore.
Well, with masks, we're realizing how little we knew, right? And I think that's really, really important. So it's not something that seems to make sense to me. We know that 3-layer masks are better than 2-layer masks when a mask is put together, built that way with cotton, 2 outer layers of cotton and an inner layer that's polypropylene. We know that's pretty effective. We know that you can make 1 mask that works that way, that's breathable, and that's quite effective. I think that's really important. To say, should we wear 2 masks, actually then begs the question, well, what should they be made out of? How should they be designed? And we don't have those answers yet. I'm glad we're working on that. The contagious variants really may, and we're really just getting started with variants, right? The variant chapter of this is really just getting started. As gets more contagious, we may actually need to do that. But I don't think we're there yet in our understanding, and I don't think we're there yet in the need with respect to how virulent the contagious variants are. The UK and Ireland brought this under control without changing their mask policies, without changing mask design. So it doesn't seem like it's the most pressing thing. And I just want people to be comfortable and safe and to be able to wear masks in a sustainable way. And panicking to say you need to strap 2 to your face, I'm not sure that's the wisdom that we need today.
Here's another question, and I've heard this from lots of people. Should we be wearing masks in the outdoors in scenarios where we can socially distance from others?
I've always been a proponent of minimizing mask use because masks get contaminated. They get contaminated by your own breath. There's a lot of stuff that comes out in your breath. Your body knows how to deal with that. But if the mask starts to accumulate bacteria, then you start to feed it with your warm breath, and then you end up inhaling larger concentrations. That can be really unhealthy. So the idea is to wear a clean mask, obviously. And the more you wear it, the more you need to change masks. And that doesn't feel very sustainable. So my approach has always been, if you're outside, take the mask off. Now, with the contagious variant and with winter air, which we think is a bit more dangerous for virus transmission, I've amended that in my own mind to say, look, if you're going out and you're just walking down the street, you might pass someone on the street. I don't think masks are going to matter. It's very momentary. I don't see it. But if you're going to be queuing up, if you're going to be in a crowded situation, if you're not going to be able to get away from other people, then a mask is a good idea. Moreover, it keeps your nose and your cheeks warm. So it's much uncomfortable than in the summertime. On the other hand, if you're walking outside a lot, you will notice that mask gets wet.
Or if you wear glasses, it's not exactly great either.
I've gotten pretty good at tucking the top of the mask under the glasses and letting them sort of push it down. But yeah, I've had a lot of having to peer through fogged up glasses, no question. So it's complicated in terms of what's sustainable and what's comfortable and what's important. When I go out walking around, I do so fully intending not to be near anybody, apart from people you might pass on the sidewalk. And so I typically will not mask, but I always have a mask in my pocket. I always have one, always, because you can't be absolutely certain about what kind of situation you're going to be in. The other thing about wearing a mask outside is that it actually allows people to telegraph what their current level of anxiety is and what their current level of comfort is. We don't know people's medical histories. We don't know, we pass people on the street, what they're concerned about. When I see someone walking down the street and they're masked up, I think this is a concerned person. This is a person who may be feeling a bit anxious. Let's have some respect for that. Let's give them a wide berth in a respectful way. And when I see people walking without masks, I think, okay, these people are less concerned. Maybe they're less safe as well. We learn a little bit about people's own predilections that way, that kind of signal. I think that's effective, or it's useful.
And you touched on one thing there too. Is there any evidence to suggest that the risk of transmission of viruses is higher, even in the outdoors, in the winter and cold air? Does it transmit easier?
So there's lab studies. And again, we've talked about how lab studies don't necessarily translate into the real world. But the lab study evidence is very clear. It says that the colder the temperature, the longer the virus survives. So when you exhale virus, it starts to die right away. It's not really alive. It can't mend itself or protect itself. It really starts to die right away. And the rate of death is given by the temperature. So in a nice, hot, sunny day, that virus is dying fast. In cold weather, it doesn't. The other thing to be concerned about is humidity. So in a nice, hot, humid day, those droplets that you exhale actually pick up water from the air and they get heavy and they fall to the ground very fast. In dry air, the opposite happens. You exhale those droplets, they start to evaporate, they get lighter, they stay in the air more. So indoor warm air tends to be dry because there's just less water in the air in winter. That to me is really dangerous. And so the number one protective thing that people can do is make sure that their air is humidified. I think that's just enormously important. What goes on outside is less clear because this is where absolute humidity and relative humidity actually diverge. So absolute humidity is lower in colder temperatures, so the air can hold less water, but the relative humidity tends to be higher. In other words, it tends to feel damp. And how the virus deals with that, you know what, we don't know. And lab studies are not actually going to be able to inform that. It kind of retreats to the idea that if you're outside and there's a bit of a breeze, that's protective, regardless of temperature and humidity, but be more concerned in cold weather because that virus isn't dying nearly as fast. And be concerned about coming inside and feeling that warmed, dry air, because that's the thing to be very concerned about. The temperature's warmer, okay, that's protective, but that dry air, I think, is a real concern. It's complicated.
Dr. Furness, a big thank you again for helping make sense of this.
My pleasure. Thank you.
And that is Dr. Colin Furness, epidemiologist at the Dalla Lana School of Public Health at the University of Toronto. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.